Great. So again, we're in our Ask the Author session today, December 14th. So thank you all. Just really briefly, a little bit about our organization who's hosting this today, because I know we have several people who are new to Prevent Blindness. So as I mentioned, I'm with the National Center for Children's Vision Eye Health, and we're at Prevent Blindness. Since 1908, Prevent Blindness is the nation's leading volunteer eye health and safety organization dedicated to fighting blindness and saving sight. We focus on a whole continuum of vision care, and we touch the lives of millions of people each year in many areas: public and professional education, advocacy, certified vision screening and training, community and patient service programs, and research. We have identified 3 key areas that we're working on in the next 5 years: education, advocacy, and empowerment, with a network of affiliates around the country and our national office, which is here in Chicago. Hopefully you can see some of the skyline behind me. We have been going for about 113 years now. The National Center, very similar in terms of our work with education, empowerment, advocacy, but in the area of children's vision. So you can see here all the areas we work in, lots of partnerships. And we are, I just want to point out our technical assistance, because I hope that those of you who are new will consider asking us for any kind of technical assistance around children's vision and eye health. So, all right. And I think most of you who are here today know why you're here, because you're interested in learning about vision for Baltimore. As you probably know, vision disorder can develop at any age during childhood and can negatively impact both health and education and children's futures and quality of life. And that's why we're having this, this session. There's lots of information out there on barriers for children getting eye care, barriers to glasses. I know our presenters will talk about that. But why I'm so excited about this particular Ask the Author is because what we're going to hear about today is an intervention that worked. And I hope you can all take some lessons from that on what you can do in your own communities. So again, please do put your, introduce yourself via chat, and then put your questions in chat. We'll be monitoring that. Okay, so I wanted to introduce our, just want to make sure Lynn's not ready yet. I don't want to take her. Okay, so I'll real quick just I'll introduce Lynn later since she's not on yet. So I just want to introduce our 2 presenters today. Amanda Neitzel is an assistant research scientist at the Center for Research and Reform in Education at Johns Hopkins University. She has expertise on school-based health interventions, literacy, meta-analysis, data management, and quantitative research design. She has worked on evaluations of school-based programs, which you'll hear about today, with an emphasis on issues of implementation, which I know is a concern for all of us. How do you make this work? She's also conducted multiple systematic reviews, including reviews of elementary literacy and educational programs for struggling readers. Prior to pursuing her PhD, Amanda was an elementary school teacher in a traditional public school and also served in the Peace Corps. Dr. Megan Collins, I will point out first, is a member of our National Center for Children's Vision Eye Health Advisory Committee, as is Lynn Meadow. So I always like to say that first. Megan's an assistant professor of ophthalmology at the Wilmer Eye Institute at Johns Hopkins School of Medicine. Also, she is an associate faculty member at the Johns Hopkins Berman Institute of Bioethics and the Johns Hopkins School of Education. Dr. Collins received her medical degree from the University of Chicago, master's in public health from Johns Hopkins, Bloomberg School of Public Health. She founded and co-directs, co-founded and co-directs the Johns Hopkins Consortium for School-Based Health Solutions. And in spring 2020, also co-founded the Johns Hopkins eSchool Plus initiative. She is also a core faculty member in the Hopkins Health Education and Training Corps. She specializes in pediatric ophthalmology and strabismus. And her areas of research include barriers and access to eye care, which you'll hear about today, epidemiology of pediatric eye disease, and the impact of refractive error on academic performance. So I want to welcome both of our presenters today. And then I'm going to start sharing their slides.
Well, as you're pulling the slides up, Donna,
wrong one, sorry. Yeah, sorry, go ahead.
I was going to say thank you so much for the invitation, but go ahead.
There we go. Sorry about that. Really feeling a little slow. Okay, I'm going to mute and take it away. Thanks so much, Amanda and Megan.
Thanks for driving the bus for us, Donna, too. I appreciate you advancing the slides. Hi, everybody. I'm Megan Collins. For those of you who don't know me, I see a lot of familiar names and faces on here. Some of our partners on programs in Baltimore and some of our research colleagues from Chicago as well. So very nice to see everybody. Hope you're all doing well as we kind of keep going through our ups and downs of the pandemic. Donna, can you go back to the first slide for a minute, please? All right, so today, Dr. Neitzel and I are really pleased to talk about school-based vision care, lessons from Vision for Baltimore. We're really so excited that recently there was a publication from our group in JAMA Ophthalmology about the academic impact. We're going to talk about that today. Seeing sort of the breadth of stakeholders on the call today, what we thought would be really important is to frame the academic impact in terms of how we got the program started, what the academic impact study, the significance of it, and also some of our lessons learned from implementation and engaging our stakeholders to learn from them what works best for programs like this. And I'm hoping that will generate a lot of discussion from all of you in terms of feedback about your own experiences and collectively things we can learn together to help get as many kids who need eye care the eye care they need. Go ahead to the next slide. These are financial disclosures that we, wanted to just disclose for you, including research funding for me. Go ahead to the next slide, please. So just to frame our discussion, we'll try to spend about 30 minutes or less on this, so we have a lot of time for questions, but I'm gonna start by talking to you about the Vision for Baltimore program and some of our exam and screening findings. Then I'm gonna turn it over to Dr. Neitzel, who's gonna talk about the academic impact study and some of our approaches towards community engagement. I'm gonna close off that second part of the session by talking about some program implementation and lessons learned, future directions, and then we're going to open it up for questions. So Vision for Baltimore, just a broad overview. This is a program that we've been involved in for now. We're in our 6th year. It was launched formally in fall of 2016. And one of the really unique things about the program is it's a citywide partnership. So all of the key stakeholders in the city, from the health department and the school system, as well as Johns Hopkins, all local partners came together with a mission of how do we connect kids who need eye care to eye care, and what can the role of schools be in this delivery. We partner with our national optometric provider, Vision to Learn. They bring the eye exams to the schools, and eyewear retailer Warby Parker, they generously donate the glasses for the program. And one of the unique features of the program, Donna, I can just flag next to you when I want to switch slides, if that helps.
I am not touching my computer, so I don't know if they were set for 30 seconds or something. I'm gonna.
Oh, fascinating.
So I'm
okay.
just, I don't know. I don't want to futz around with it, so I will just go back if you're not ready. So sorry. No, I'm sorry. Go ahead.
So one of the things about the program, and I think those of you on here who either have had eye problems yourself, had children with eye problems, or work in the healthcare, the education profession, that sometimes people need glasses. With kids, a large amount of the time, they don't even know that they need glasses. And that's why screenings become so important. The challenge, however, screenings are not an eye exam. Screenings simply detect somebody who's at risk for an eye problem and they need an eye exam. And we know what happens is when kids get referred for an eye exam after screenings, unfortunately, in a lot of high poverty communities across the US, those kids often don't connect to the eye exam. Even when they do connect to the eye exam, sometimes they don't connect to the needed glasses afterwards. Even when they do connect to the needed glasses, sometimes they don't get the repairs and replacements needed when those glasses inevitably get lost or broken, as will naturally happen with all kids. So the goal of the program was to bring all of those components together, the screenings, the eye exams, the glasses, directly in schools, and recognizing how critical it is to have our school partners help engage not only in the participation of the program, but also making sure kids wear their glasses as prescribed. Go ahead to the next slide, please. So as I mentioned, one of the critical features of our program is everything is delivered directly at school. In a world, if we can imagine, again, before COVID, this worked really well because kids were in school, 8 months of the year, 8 hours a day. And the operations of the program are such that the health department conducts all of our vision screenings. Kids who don't pass the vision screenings are provided a permission form for an eye exam. The eye exams are performed by Vision to Learn optometrists. If children need glasses, they're able to pick their own frames, and that agency for kids we find is really important. Warby Parker has been very generous in donating lots of colorful, fashionable frames that the kids like. Our city schools partners do tons of outreach with their school communities, not only so they sort of know that the program exists, but that they help get people to return the forms that we need in order to provide the eye exam services. The Hopkins team, we've led an ongoing research study that we're going to talk about today. But one of the things that we've done at the same time is we have school vision advocates that are full-time and they work directly as liaisons with each school, and they support the implementation of the program. All of those, anybody who I think works in school programs knows there's the program, and then there's all the nuts and bolts around making the program actually work, which is the communication with parents, the collecting forms, the organization, the logistics part. So they help support that. Go ahead to the next slide, please. And we're very proud that we've had a ton of success over our 6 years of the program, now having screened over 65,000 students, performed over 11,000 eye exams, and given more than 8,200 kids who needed eyeglasses the eyeglasses that they need. I'm going to transition in a minute into some of the lessons we've learned from these kids who've gotten the screenings and glasses. The next slide, please. So what have we done during COVID? I'm very proud to say we have been able to continue operations throughout the pandemic, with the exception of, I guess, March 13th, 2020 through July of 2020, we were interrupted because schools were closed and we were in lockdown state at that point. But what we did is when we reopened program operations, we took infection control very seriously. We modified all of our exam techniques, and we still had the mobile clinic come to schools. A lot of the schools for part of the past school year were actually closed. So even if the clinic came to the school, it may still be that the parents were doing something essentially similar to an eye doctor appointment, where we'd make an appointment, kid might be at home for virtual learning, but they would come to the school to have their eye exam, and we would do, screening assessments before the child had their eye exam, and then they would go home afterwards. They would get the glasses. We recognized, because of COVID and how that interrupted children being in the classroom, it was really important to do more health education and outreach to parents. I'm sure all of you have sort of witnessed that kids during COVID have been spending a lot of times on screens, and we've actually seen more issues of digital eye strain, more kids becoming nearsighted, and more people sort of wondering when children need screenings and eye exams. So we've taken this time to make sure we're trying to educate people about all of those lessons. Go ahead to the next slide, please. So I'm going to go through some of the lessons that we've learned, starting with our screenings and eye exams. And as I mentioned previously, screenings are an assessment of whether or not somebody is at risk for an eye problem. In Baltimore, there's a couple different components to our screening. We do a distance acuity measurement. We do an instrument-based screening with a spot vision screener. For the younger kids, we also do stereo, that's like your 3D vision. And we do cover testing, which is a way to see whether or not somebody has misaligned eyes. Go ahead to the next slide, please. A couple of these graphs are going to get a little bit busy, so let me just walk you through some of the key points. The first thing is 1 in 3 kids in Baltimore over the study period, which was the first 3 years of the program, that's 2016 through 2019, were failing a vision screening. So that's across all grades. This slide breaks it down by grade, what the percentage of kids failing a screening were. As you can see, this trends upwards from kindergarten all the way to grade 8. We do not currently provide screenings in high school, but I suspect if we looked in high school, we would continue to see things trending upwards. The color distinction here between blue and yellow is the grades. Blue are the grades that are mandated by the state of Maryland. So most states in the US mandate vision screenings for at least some levels of grades. either in elementary or middle school, occasionally in high school. For the state of Maryland, it's grade of first entry, which is usually pre-kindergarten or kindergarten, first and 8th or 9th grade. So as you can see here, we have kids, of course, failing in the grades that are mandated by the state, but we have an equal, if not greater number of kids failing in the grades that are not mandated by the state. Significance of that is just across the board, we have lots of kids who are not passing vision screenings. That's number one. Number two is that even when you're doing screenings, this really helps kind of drive home the point that kids are clearly not connecting to care. If they were connecting to care, you would see a drop between grade 1 and grade 2, in that, you know, kids would get connected with care, and then vision screenings would hopefully the failure rate would drop the following year, but we just see it go up and up and up. Go ahead to the next slide, please. So the second thing is, you know, what types of things do we find on our eye exam? For kids, by and large, the most common thing that you're going to find on an eye exam is refractive error. That's whether they are nearsighted, which is myopia, farsighted, which is hyperopia, or astigmatism. Occasionally, you will find kids with other non-refractive issues. Those are things that I often deal with in my clinical life. So those are kids who might have pediatric cataracts or glaucoma, or something called strabismus, which is crossing of eyes, something called amblyopia, which is reduced vision from a number of causes. For the kids that we see through our program, I would say 95% of the kids simply have refractive error. About 5% of them have something more complicated. The kids with something more complicated need to be referred into the community. The program, any school-based programs, I would argue, are just not equipped to handle those within the school setting. Those kids need to be connected with community optometrists or ophthalmologists to figure out what's going on and give them a long-term treatment plan. But for the kids who simply need glasses, go on to the next slide. This is going to give you the breakdown by grade about what we're seeing. Again, a little bit of a busy slide, but let me kind of draw your attention to the most salient points. The first thing is the red bar. The red bar is myopia, which is nearsightedness. So nearsightedness is I can see my computer screen, but I can't see without my glasses to drive a car. So I can see near well, but I can't see far. And what we see is the nearsightedness is increasing. It's trending upwards with higher grades. The flip side, farsightedness. Farsightedness with kids, they usually don't need glasses at all. Sometimes adults with farsightedness start needing reading glasses. So they need glasses for up close, but they can see well far away. We see that trends down. That's pretty much what we expect within kids. As they become more nearsighted as they get older, they become less farsighted. We also see a decent number of our kids that have astigmatism. Kids with astigmatism can have blurry vision for distance and far, and need glasses all the time. The final category there is something called anisometropia. That has to do with difference in vision between both eyes. And as you can see, astigmatism and anisometropia are pretty constant as you go through the grades. Go ahead to the next slide, please. So the next thing is, okay, we find lots of kids with refractive error. What do we do about it? And we provide them glasses through the program. So we did also want to ask the research question is, what type of differences are we seeing in vision? Go ahead to the next slide, please. And this is a breakdown of what number of lines of improvement they have in their visual acuity. That means on that chart that you're probably familiar with the big E, how many lines do they get down towards 20/20? And the remarkable thing is kids do incredibly well and really get to exceptional vision with the glasses provided through the program. Now I'm going to turn to the other side of things. How does this impact learning? Go ahead to the next slide, please. And I'm going to turn it over to my colleague, Dr. Neitzel, who will tell us whether it's normal that slide is blurry.
Thank you, Megan. I have this set up there. Okay, thanks, Megan. I am very excited to talk to you about this today. Okay, one of the exciting parts of this project was that the study looking at the impacts of school-based vision care on learning outcomes. A lack of access to care may be part of the explanation for why students struggle in school. As Megan sort of illustrates with this slide, if what you're seeing at school is what's on the left, that is going to make things challenging. Our project was able to test this using a rigorous experimental design. Next slide. Thank you. So as Megan already mentioned, the results of this study were published in JAMA Ophthalmology earlier this fall, but I'm going to go over that for you briefly. For the study, schools were randomly assigned to each of 3 years. So each year we served 1/3 of the schools in Baltimore City that served pre-K through 8th students. So with that design, at the end of each school year, we have a set of schools that have been served and a set of schools that haven't been served yet. So we can make some comparisons about what's going to happen or what has happened. Because it's important to assess the impacts on learning and education, we used assessments that are already given in school. So we're looking at impacts on scores that schools are accountable for. We looked at their state standardized test at the time, the PARCC, in English Language Arts and Mathematics, as well as the iReady, a commonly given assessment that can be given multiple times a year to see how students are doing throughout the year, as well as provide a summative score at the end of the year. And that's given in English Language Arts and Mathematics as well. So we looked at the impacts of the program for students who receive glasses in the first and second year of the program, compared with the students who have not yet received their glasses, kind of looking backwards. Our main research questions were, what were the impacts after 1 and 2 years, as well as whether those impacts varied for students with specific characteristics, such as by gender, special education participation, or baseline achievement. Next slide. Perfect, and this is what you've all been waiting for. Regarding that first research question, we found improvements on the iReady ELA assessment. They were significant after the first year, not on the other assessments in mathematics or the PARCC, but that result on the iReady English Language Arts assessment was a robust, statistically significant outcome, which is very exciting. We found similar size results at the end of the second 1-year period and then the 2-year period, but the sample size was a lot smaller, so it wasn't significant. For our second research question, we focused on particular subgroups of students. So like I said, we looked at different, students in special education, students who are performing in the lowest quartile at the beginning, female students, students who are English learners. So we looked at a lot of different groups of students. And we found that these impacts were especially large for students in special education and students performing in the lowest quartile at baseline. So in short, in one sentence, to sum this all up, the program helped students improve test scores, and it was especially beneficial for those who needed it most academically, which is very exciting. Next slide. So we know this worked, but I want to help you contextualize the size of these impacts. In research, we often talk about things in terms of effect size, which is just a standardized way to talk about impacts across studies, across tests, across grades. And things are then measured in standard deviations. It's really important to understand this so that we can actually compare how did things work when they're using different research designs or using different populations or using different tests. So it's just important to know you can compare between them and that bigger is better. So I'll explain now how Vision for Baltimore compared with other common interventions we see in education. And so this is actually a big part of my work, is identifying what works and helping to disseminate that. So starting all the way over on the right-hand side, you can see the average effect size for a few common educational interventions. So charter schools, extended school days, and educational technology. You actually hear about some of these a lot now with using the ARP funds to help make up for learning loss. And you can see the average effect sizes for those are in the 400th, 500th, so 0.04, 0.05, pretty small. And then you can see the impact of the full sample and Vision for Baltimore, 0.09. So already we are larger than some other common interventions that you see throughout education. So that's really exciting. So this result isn't just statistically significant, it's actually of practical importance. So this is a real valuable intervention that could make a real difference in closing achievement gaps and improving outcomes for students. But then what I find even more exciting is as you move further to the left, you see the outcomes for tutoring, both small group and individual tutoring are sort of 0.2, 0.25. Those are some of the most effective interventions in education. And this is also why you hear so much talked about with tutoring and the ARP funds, because as I said, that's one of the most effective interventions across education. And then you see Vision for Baltimore for those students who are performing in the lowest quartile at baseline. And it's the same for students in special education, is 0.28. So this intervention, providing glasses with schools and that ongoing engagement that Megan's going to talk about next, is actually comparable to tutoring, which is incredible. So this is actually a really exciting way to think about helping students in schools. Next slide. Another way to think about this is in terms of learning gains for all students. So across the entire sample, looking at everyone, the impact of this program is equivalent to an additional 2 to 4 months of learning, which is amazing. For those students with low baseline achievement and students in special education, it's an additional 4 to 6 months of learning. That is amazing. There's not much in education that is that effective. And this is one way to help us close those gaps and get kids at the level of their peers. So this model and these results really illustrate that beyond just providing needed vision care to students, which we should, it may also be an innovative way to improve student learning. Our results show that simply providing academic help, such as through tutoring or supplemental instruction, might not be enough. We need to address students holistically, including their vision health. And I'm going to turn it over to Megan to talk a little bit about what we learned in terms of implementation.
Great, thanks, Amanda. We can go to the next slide here, which is how do we engage the school community? So hopefully what you've gathered so far by what Amanda and I have talked about is, we have demonstrated the substantial need in that 1 in 3 kids are failing a vision screening. We've demonstrated that we have an effective model for bringing eye care to school for refractive error needs. And of course, as Amanda just showed us, we've seen profound academic impacts for kids, and with differential impacts for kids based on kids in special education, kids in the lowest quartile at baseline. So the flip side of it, and something Dr. Neitzel and I spent a lot of time thinking about as well, is how do you successfully sustain the program and scale it, because these findings have implications, I think, for other school-based programs or other people interested in doing school-based programs across the United States. So the next part, we're just going to talk about some of the fun things that we've done to engage our community and some of the lessons that we've learned through talking directly to our stakeholders. So this is, of course, us during COVID, everybody wearing their masks as recommended. Go ahead to the next slide, please. So one of the things that's really important is kids need to wear their glasses. And I know we have some eye care providers on the phone here today as well who know how important this is. But Amanda and I had done some work even before Vision for Baltimore, looking at what were the factors most predictive of kids wearing glasses. And it turns out, what is really powerful is whether or not their parents and their teachers remind them to wear them. Even in our study, actually, even more so than whether or not the glasses helped them see more clearly, whether they liked the glasses. It was that nudge. It was that recognition from somebody who they respect, and to kind of say, hey, wear your glasses, go ahead and put them on. Those reminders are important. So in order to have those reminders in the first place, our school vision advocates do a lot of outreach to teachers and to parents about knowing these kids in your class got glasses. Make sure that you know about our replacement program. If the glasses are lost or broken, of course, we will replace them. So we have not only sort of that time where we come to school for the screenings and the eye exams, but also that continued dialogue with teachers so they are aware of the resources and the need to wear glasses. Go ahead to the next slide, please. As I mentioned, during the pandemic, we've done a lot of outreach to teachers and parents, and we've used social media. So we have, feel free to follow us on Instagram and Facebook now. I think we're at visionforbaltimore.com as our website, and we're on Facebook and Instagram as well. So we constantly send out messages about vision and eye health. We constantly sort of have information about, where is the mobile vision clinic going to be this week? Where are places to go for additional questions or resources? We also have done a bunch of short videos about sort of what does it look like to get an eye exam? What does the inside of our mobile vision clinic look like? What's the difference between a screening and an eye exam? We've also done some sessions via webinars on Zoom about how to protect children's eye health during virtual learning, which was a big thing last year for us in Baltimore. Go ahead to the next slide. When we had opportunities to be in person, one of the other things that we did, and this is Dr. Neitzel giving one of these presentations, was giving teachers, practical tips about how do you help your students with their glasses? How do they take care of them so that they don't break so often, because we know that they sometimes will. Storage, wear, care, maintenance, things like that. Go ahead to the next slide, please. We also constantly want to engage the kids, and all kids, not just kids who get glasses, but all kids, to sort of empower them to appreciate the importance of vision and eye health. And also, you know, I think selfishly, Amanda and I both feel this way, that we really want to create a pipeline for in STEM for people who are interested in STEM careers. And I think starting and intervening early and getting them excited about science and hands-on things like cow eye dissections is a really good way to do it. Go ahead to the next slide, please. So aside from the ongoing engagement that we do in schools, we actually, about 2 years ago now, maybe it's 3 years ago, losing time with the pandemic, we did some focus groups. And we did focus groups in both Baltimore and Chicago. And I do want to recognize some of our Chicago colleagues, including Dr. Stephanie Johnson-Brown and Catherine Stafford Hudson, who really are the anchors of Chicago's vision program, are on the phone with us today as well. So we're glad to have them here. But a couple of years ago, we did focus groups with parents and teachers in both cities. And they may have participated in the program, they may not have participated in the program, but we tried to get a broad sample to understand people's perspectives about school-based vision programs, what worked, what didn't work, as we're trying to go through a continuous improvement cycle to make things better all the time. Go ahead to the next slide. So one of the first things that we tried to understand, and we ran into this problem specifically in Baltimore, is when the program started, we had a lot of people not participating, and we wanted to understand, why are people not participating? And that means that a child would fail a vision screening, a form would go home, but we wouldn't get the form back. And we wanted to understand, why is this happening? Turns out there's 5 main themes that came out of that. One is simply, and the biggest one, was lack of awareness that the form may have gone home, but it may not have made it out of the backpack. And all of these things I'm going to highlight are things that we've then gone on to try to, improve the program and improve engagement because of. Another was simply just misunderstanding of cost and eligibility, meaning I can't participate in this program because I have insurance, or I can't participate in this program because I don't have insurance. Some things were simply attitudes about vision and eyeglasses. They may have had an experience as a child like I did. I wore glasses. Somebody called me 4 eyes. I stopped wearing glasses after that, and they were worried about their child being teased for wearing glasses. Sometimes it was that they already had an eye care provider, which is wonderful. So for kids who already have an eye care provider and don't need to use the program, that's great. So it's pretty much a very small percentage of kids that this was the case with, but I think it's important to know that's the case sometimes. And sometimes they just didn't trust a program that was being offered by schools. They didn't know if it was going to be the same caliber as going into the community. And this was pretty rare, but I think just important things for people to recognize with any school-based health interventions. The challenge that we have all of the time with school-based health is parents are often not there for the screenings or the eye exams. So sometimes they don't believe the results because they don't notice that their child has a vision problem. We know, of course, that most kids with vision problems don't have symptoms. So it would be normal for parents not to see anything, but there's often that disconnect. Go ahead to the next slide, please. So then we did focus groups asking parents and teachers, what do they think are the best things about the program, and what are some of the things that they think that we could do a better job at? And across the board, everybody loved that this happened at school. It was great in terms of location, time, and cost. And the comprehensive nature in that it provided eye exams and glasses. In Baltimore, we do the screenings as part of the program as well. And they, had a positive experience across the board with the optometrists and the school staff, and really enjoyed the program. They loved the glasses. They loved the colorful frame selection, and they loved that they were able to get replacements. Some of the limitations and areas of suggested improvement were ongoing communication. Sometimes they would get something early in the year, but not get something immediately before the program started, and sort of understanding the different components of the program. In Baltimore early on, there was a time lag between getting prescribed glasses and receiving them. So we had parents say, can we make that shorter? There were concerns at times about missed instructional time for getting the screenings and glasses. And again, back to this issue of When the parents aren't present, they do sometimes have questions about whether their child was quote unquote faking it because they wanted to get glasses, and sort of trying to understand the results. Go ahead to the next slide, please. We also asked teachers and school staff specifically about how they felt about the program and what they were doing to support the program. There's prior research that has shown sort of how critical teacher engagement is to any type of school-based health interventions. In Vision, we saw them really doing two different things that were incredibly valuable to the program. First was outreach to parents. They were trying to support that communication. They were trying to support the receipt of those permission forms so children could participate. They were also doing things within the classroom to promote eyeglass wear. Really creative things at times, like eyeglass songs at the beginning of class, checking eyeglass wear when they were checking attendance, and really trying to encourage kids to wear glasses. This corroborates some of our earlier research showing how important teachers are to that process. The interesting thing here is teachers were assuming roles that I think are going to address and are already addressing a lot of the barriers to student participation, in that they were that critical link at times between a program existing and a child participating by building that relationship with parents and sometimes giving the information from a trusted source about the program. Go ahead to the next slide, please. We also asked parents' perspectives about what were things that they would like to see enhanced with the programs. And one of the things was sort of a timeline of understanding what happens during the school year. When do screenings happen? When do eye exams happening? What's the difference? We constantly get that question. What's the difference between screening and eye exams? What's the difference between an eye care provider and an optician and a school nurse, sort of understanding the different individuals who might be involved in the process. They asked for education about eyeglasses use and maintenance. How do you care for them? When do kids need changes in prescription? When do they need repeat eye exams or screenings? And they also asked for resources at times, including like lanyards that kids could wear around their neck with an eyeglass case and eyeglass cleaner. I should mention, for all of these things, one of the challenges is these are things that the programs are already doing. But this underscores that there's sometimes a disconnect between what programs are doing and what parents are receiving. And really there's a value in kind of multimodal approaches to communication, as some people may, respond to stuff by email or social media versus paper pamphlets going home with backpacks. Go ahead to the next slide, please. So to put this all together, I think, one of the things that we really have learned through our work in Baltimore is there's just a profound unmet need. Again, I go back to that 1 in 3 kids was failing a vision screening. That's an incredibly high number. And we were able to build a system within schools that provided kids with eye exams and glasses. This groundbreaking research that Dr. Neitzel talked to us about today showed that we're improving learning performance too. Now, that was big before the pandemic, but with the pandemic, that's even more significant as we're pivoting to think about learning loss and recovery. So I'd argue that what we're trying to do in Vision for Baltimore and other school-based programs more broadly is really have models that are not only advancing health equity, but also educational equity and closing some of these achievement gaps for disadvantaged students in school districts across the US. We're going to advance to the next slide if we can. These are email addresses for Amanda and myself. Please feel free to reach out with any questions. And now we timed it well, Amanda. We've got 30 minutes left for questions. We're happy to hear from all of you in terms of questions or experiences you've had in this space.
Myself back on. All right, so thank you so much. I am going to now introduce our moderator real quickly. We're really excited to have with us Lynn Meadows, who's the coordinator for student health services for Fulton County School System in Georgia. Lynn has over 30 years of healthcare nursing experience. She's worked with the Grady Health System, and for the last, I think it's about 21 years now, with Fulton County as the coordinator. She's been named in School Nurse Administrator of the Year by the Georgia Association of School Nurses. She's involved with the National Association of School Nurses. She's a data champion, and her work is focused on refining school health services and programs, promoting uniform school nurse data collection, school nurse leadership and education, and school-based health centers. And like I said, for Dr. Collins, Lynn serves on our advisory committee for the National Center for Children's Vision and Eye Health, which I should have said first. So Lynn is going to just give us a little bit of a perspective from the school nurse, school health coordinator perspective, and then she's going to start asking some questions, and she and I will monitor while she's chatting. I'm going to look at the, I'll also look at the chat, and then we'll start our audience questions. So Lynn, thank you.
Awesome. So thank you, Donna, for that introduction. Can you all hear me okay? Thumbs up? Awesome. Well, first of all, Dr. Collins and Dr. Knight, so what an amazing presentation in a short amount of time. I don't know if you can see from my desk is very cluttered, but I have pages of notes that I took to improve our own vision program here in Atlanta, Georgia. So I'm in the 4th largest school district in the state of Georgia. And ironically, this is perfect timing because we just in the last 3 months established a partnership with Vision to Learn. So I got so many ideas from you all. That was amazing. I'm so excited to hear what you talked about the data, because I know from having worked in the school district for 20 something years, we often come and ask about programs and want to introduce programs and services. But when you talk about introducing a program and service that you can tangibly see and from data driven improves academic success, any superintendent, any state, any legislator will stop and listen to that program and that services. And what I loved about what you said is that the data and the information that you shared with us about gauging this to other programs and services, this is more important than any other educational intervention. That is huge. And you have the data to back it up. That is huge. And I loved when you talked about all of the partners you have and the engagements. And I'm sure that some of the questions are going to be centered around how did you even start all of those partnerships? Because like I said, we just started our partnership with Vision to Learn, but you have all of Baltimore on board. So how did you do that? How did you get all the players involved? So that was very, very exciting to me. So Donna, I don't know if we already have our first question, because I have lots of questions, but I don't want to take over with my questions. I want to actually see what's in the chat. So first of all, it's very nice to meet both of you all. I will be in touch with both of you all. And I think the first question that I see is, what role could school health education have on students and future parents to understand healthy eyes and habits? So that's around the educational piece. And I think Dr. Collins, you talked about that.
Sure, and that's from Catherine Carter, who is an exceptional advocate for children's vision and eye health in the state of Maryland. So Catherine, hello. We were talking about some of your work with the Atticus Act with the Maryland Department of Health earlier today. So if your ears were burning. So a lot of things that I'll give a shout out to kind of some of Catherine's work, because what she's doing, I think, complements our work a lot in that people need to know vision screenings. They need to know the difference between a screening and an eye exam, and they need to know kids who need something more than a school-based vision program can provide. So this is not the eye exam for children who are on systemic, medicines by mouth because they have some complex medical condition. This is not for the kids who, have a family history of some significant eye disease. So there are things that screenings will not pick up. And it is important to have those aspects of health education that help parents understand that. So what will a screening detect? What will a screening not detect? And if your child falls into any of those categories, those are kids that still need to be connected into the community. And I think a lot of the work that all of us are trying to do in this area is recognize what can happen in schools, what can schools help support, and what do we need to build better bridges to our community providers for. So thank you.
Thank
Catherine.
you for that. And I'm sorry.
Oh, I was just saying
thank you, Catherine. And one of the things that I also wrote in my notes was really what you talked about is a 6-part comprehensive program. And you talked about screening, exams, glasses, making sure that there's ongoing services, making sure, which is important, a piece, the kids are actually then wearing the glasses. And then the sixth part is education, and education with the broader group, parents, the students, and then folks at school. So excellent, excellent, excellent. That in itself to me is a short model. So the next question is, which is an excellent question, what is the cost to run a school-based eye care program? So Dr. Neitzel, you want to take on that one?
No, that's actually a question for Dr. Collins.
That's awesome. I will take it on. I will say I just got like a flag on my screen that my internet connection is unstable. So if I happen to freeze at some point in time, I'll pop out and pop back in. It is a good question. It's a little bit of a complicated question to answer in that, Lynn, I love, and I'm going to take notes from you about how you sort of broke it down into these different components of the program. So I need to borrow your crib sheets too. But so it really depends on the costs of the program. Let me break it down into the components. There are screenings, there are eye exams, there are eyeglasses. All of those are components. The other thing that Lynn just highlighted, we think is really essential is this advocacy and engagement element. That unfortunately is not something that is like Medicaid reimbursable, but those are the things that are really important for making sure a program works. So depending on sort of what your school system and sort of who's doing screenings and who's doing eye exams, the cost might be different. Vision to Learn does eye exams in a lot of different school districts across the US. And I think they sort of have, depending on the school district, they sort of have set costs. Everything has, unfortunately, we all know this from lots of other things, everything has increased during COVID because you can't see as many kids as quickly. So you're in schools for more days than previously. So the cost question is sort of an evolving one, but I think it's first important to understand the components and then the components that are reimbursable.
Thank you so much for that. And so the next question is, what was the consent form return rates or percentages for the kids who failed their screenings? And then there's a part two. Also, did the improvement rate change between year 1 and year 2 of glasses for students who received them in the first year? And I'm happy to go back and review that second part, but the first part of that question was, what was the consent form return rate or percentages?
Amanda, do you want me to start with the first part and you do the second part?
If you want to, I just pulled up the Holly paper as well, so I've got a number even.
Perfect, then I will turn it to you.
Okay, so about consent form returns. So I think Megan talked about how this is a challenge, and anyone who's done work in this space knows that consent forms are a challenge. I will say that our work with this has improved every year, and I'm shocked at how well we're doing this year, even in the whole context of the pandemic. We actually published a paper, which I'm putting in the chat right now, that gives more details about this. But this looked at the consent rates across all of the schools, including and what was sort of associated with it, because some schools do much better with it and some schools it's more of a challenge. But in this, the average consent rate was around 58% of students who needed it joined in the study. And like I said, that has actually increased over time. It's higher now, but it does take time to build trust in the community. So that was part of those. Megan did a lot of work leading those focus groups to really hear from people, because you think, we're giving all this information, why aren't people participating? But you really have to listen with, well, you're giving all this information, they're not hearing you, which led to things like our team shows up to block parties, we show up to school open nights, we show up to school talent shows, we show up to anything in our yellow shirts, and we stand around and just talk about vision and talk about glasses. And people have come up to me and asked things like, well, my kid sees this doctor and this is his eye exam. You know, he's taking medication and it's very extreme, you know, should he participate? And it's like, no. He should keep seeing his doctor in the community. And then other people talking about glasses don't make your eyes worse, and sort of just having those conversations to help build that trust and help educate people about the program. But so you can see initially it was around 58%, though some schools are higher, some schools are lower, and it's much higher now. I hope that answers it.
Yeah, Amanda, I was just going to add on one thing probably relevant is our consent process. So in Baltimore, we are a paper-based opt-in for the eye exam. So before the vision screening, And opt-out consent goes home, which is a notification to parents to say, we're going to do screenings at your school this year. If you don't want your child to have a screening, please contact, so-and-so. For the eye exams, it's different though. There is a paper form that goes home that says your child did not pass the screening. We're recommending an eye exam. Please complete this form, bring it back to school. What Amanda and I have done a ton of work over with our school vision advocates the past couple of years is how to get that form back, how to A, make sure it gets home, how B, to make sure it gets back. And some of the things that we've done and we've learned a lot from the Chicago program about this is Chicago has and Catherine and Stephanie, please correct me if I'm misrepresenting any of this, but Chicago has a program that's a school-based program, but they have a paper-based consent that goes home at the beginning of the year with a school health packet. And people, know to expect it over time. That's really become kind of a valuable institutionalized thing for schools, and parents know I fill out this form at the beginning of the year. If my child needs an eye exam during the year, they get it. So what we sort of were encouraged to do in Baltimore was think about something similar. So by year 4, we had adopted what we call quote unquote universal consent, in that we would send something home at the beginning of the year that says, your child is going to get a screening this year. If they don't pass the screening, we're going to offer an eye exam. Do you want to participate? Yes or no? We got a decent number of forms back. We probably got about a third of the forms back that way. Then we did part 2 was after the vision screenings happened. We sent those forms out again that said, now your child has failed a vision screening. And we hadn't heard from you already. Would you like your child to have an eye exam? And it bumped us to probably about 65%. The numbers that Amanda originally showed were our year 1 to 3. And I'm telling you a little bit about year 4 and 5 until the pandemic kind of threw things off. Then what we did is we developed a partnership with the schools to call parents, and either the teachers or our school vision advocates would reach out to parents if we didn't get the paper form back after the screening, to get the forms back. So we would call them and say, we sent you a form. Can we talk a little bit about the program with you? And do you agree to participate? And we would do telephone consent. So those elements of universal consent at the beginning of the year, follow up paper-based consent after screening, and then follow up with a telephone call for those stragglers, got us to anywhere between 85 and 100% within schools. So it really sort of goes to show this importance of building engagement and creating place for dialogue, so that people, if they have questions, they know that somebody will help them answer them. And as Amanda talked about, we have yellow is on blue is our Vision for Baltimore t-shirts and logo. So we went to all the back to school nights in school. We staff informational booths. So we try to be constantly accessible so people can learn about the program. Amanda, I'll turn it back to you for the 1 and 2 year.
Okay, perfect. Thank you. So yeah, thank you for adding the process too, because like Megan said, now I think we're averaging around 80% this year, which is real, but some schools are at 100%. So it took time to develop a process that works, but we have that now. Okay, improvement rate change between year 1 and year 2. It did not. Actually, the effect size at the end of year 1 for that sample was 0.09. The effect size for the second 1-year sample was 0.12, and the effect size for the 2-year sample is 0.08. So those are basically all the same. So the size is the same. What is different is the number of students involved. So at the end of the first year, we had all of the schools either treatment or control, but then at the end of the second year, 1/3 they've had their glasses too long, so they're out, so their sample is reduced, which in statistics is a big deal. So those weren't statistically significant, but the size is the same, which makes it's promising. Okay.
So thank you for that. So here's a question about the research.
Mm-hmm.
So the question is, in the research, were you able to, sorry about that. Were you able to determine if the iReady assessment is fair or valid assessment for students with uncorrected refractive error? Providing glasses and addressing vision problems gives students an opportunity to be fairly evaluated and assessed for academic progress, for special education eligibility, etc., in addition to an opportunity to access learning in the classroom. So again, the question is, in research, were you able to determine if the iReady assessment is a fair or valid assessment for students with uncorrected refractive error?
Whew, Rebecca, that is a great question. For the first part, no, I don't think anyone has looked at whether it is a fair and valid assessment for students with uncorrected refractive error. It is given on a computer, which I think opens a lot of opportunities for additional accommodations for students. Increasing the size, increasing, having it read aloud. I think there's some options there, but I don't think anyone has looked at that question specifically. So in some ways, we don't really know what causes that increase in learning. It could be a matter of just making the students already knew it and just couldn't show it until they had the glasses in order to actually perform well on the test, or it actually allowed them to access the learning and opportunities available in the school. It could be a combination of all of those things. That's one of the unfortunate things of randomized control trials is you learn if it works or not, but it can be very difficult to test exactly, well, how does it work? Which part of this is making it work? So unfortunately, I can't give you any clarification for there. It could be making the test easier for students just because they're not getting any sort of visual strain from trying to read something that they can't. We don't know.
And one of the things that I thought was key that you all mentioned in your presentation was especially for school districts to take this into consideration is iReady was something you certainly evaluated, but one of the notes that I took down was you can utilize any assessment that you already have in schools. Yeah. To measure and use as your data. And I think that's a very, very important statement. So I appreciate you including that in your presentation. So the next question is, who were the key contacts within the schools that supported the process? And I too heard you mention something, you mentioned the school vision advocate, and I'd love to hear more about your school vision advocate. So the question is, who were the key contacts within the school that supported the process?
Great, Amanda, should I get started and then turn to you? Okay. Lynn, I'm going to expand the question a little bit to a question that you asked earlier, which was how did we get started in the first place and how did we develop the relationships with sort of our stakeholders across the city? Because I think that's sort of part one. And then part two is sort of what happens when we get into the schools themselves. So we were really fortunate to have fabulous leadership across the city. At the time that the program started, Dr. Lena Wen was the health commissioner of the Baltimore City Health Department. We have an exceptional superintendent of Baltimore City Schools. Currently, it's Dr. Sonia Santelises, President Daniels from Johns Hopkins University. They all really leaned into, we need to be doing something to help support kids and their well-being, and we think vision is a priority that we can work on together. At the same time, equally important, and this comes into some of the funding questions, we had funders, and particularly some local funders, including the ABLE Foundation, who thought this was imperative and provided some of the funding support that helped us the first few years of the program. Annie, Casey, and ABLE were just instrumental. So having that support across the city, I think was just incredibly critical for us having the success to even get the program off the ground. When we then think about what we do day to day that sort of allows things to operate within schools, it's key to have both individuals in the school who are our kind of colleagues, as well as that we had a team from Johns Hopkins called School Vision Advocates, who were that glue. Because we have one partner providing the screens, we have one partner providing the eye exams, we have somebody else providing the glasses. So making sure that those pieces all work together and that information gets sort of passed from one person to another. And then you throw on top of that, we were doing a research study for our first couple of years. The School Vision Advocates I always like to call them the glue of the program. They brought all of the pieces together. Amanda, can you talk a little bit more about on the ground in schools, sort of who we built relationships with and the importance of that?
Yes, absolutely, because I think that was key as well, because schools are diverse. Even within a single district, schools vary a great deal. And so the School Vision Advocates worked with a team at the school. It generally included someone from the administration, so the principal, the vice principal. It would include someone like from a school counselor, someone from the school health team, It could include our schools are community schools, so they'll have like a community school coordinator. It could include different classroom teachers who are interested. So at each school, you sort of identify who are the key stakeholders who are going to take this on and assist with this. And then you work with those schools to see what sorts of approaches and strategies work. So our school vision advocates sort of come in with a toolkit of lots of ideas. And then you have to see, well, what's going to work in this school? You know, this is a K-5 school. We serve only elementary schools. It's very small. Or, well, this is actually middle school and it's very large. You're going to do different things in those schools. So they really would identify those people. And it varied in the different schools. In one school, one of the crossing guards actually was one of the most important players because she saw the kids as they walked into school and she knew all the parents and she was very motivated. So she was incredibly helpful. But in other schools, it might be, you know, the school librarian who sees people, and the school community coordinators are also helpful in all of the schools now. And I think every school in Baltimore now has one, but they didn't when we first started. So it's really a lot of just making relationships, stopping in. For a while, the SVAs had a rule that if they were going to a school, they had to have something with them: coffee, chocolate, paper, markers, Kleenex, anything. And so we were sort of trying to build goodwill that we understand that this is extra work for you and we appreciate you and what you're doing. And that really made a difference, I think, was just they build relationships in these schools and get to know people. And but it varies at each school too, which makes it even a little more challenging to do at scale.
But that relationship that Amanda's talking about is so important. It's not sort of going in with this presumption of we have this fabulous program and we're going to bring it to your school and you're just sort of going to, you know, you're not going to be an active, engaged stakeholder in the process. It was building that relationship. It was give and take. It was people saying, better to come this time of day than this time of day, better to come this month than this month. That is really critical to the success of a program like this. There's another school district we're talking to right now about implementing the program, and we had a meeting with them this morning. We started talking about, well, you know, we need to kind of navigate around when standardized tests are for this versus this. We happen to have, you know, a high bilingual population in this school. So things that we don't know, we really rely on our school partners to flag. And I think it's critical to have that open relationship.
Mm-hmm.
Excellent, excellent. And having, again, working in the school district for 21 years, you're so right. You're so right. Our school system, we have 93,000 students and 108 schools. And what I like to tell any team or partnership, at all 108 schools, there's a new CEO. And even though we have standards, everybody's personality in their school is different. So that's spot on. So another question is, any suggestions to getting funding for awareness advocacy part of the program? I agree it is key to success. Great presentation. Thanks to for the Chicago acknowledgement. So the question is, again, any suggestion about getting funding for the awareness advocacy part of the program?
And I will just, if I could just chime in, because thank you. That was Stephanie Johnson Brown, in case you didn't see who that was. But also Paula Tattersall, Massachusetts, asked, what is your advice on how to make the program sustainable? Will it always rely on philanthropy, or are there other solutions? So I'm just going to merge those two questions because they're both about funding, if that's okay. And this will be our last question because we are almost out of time.
And Donna, both Dr. Stephanie and Paulette are on our advisory committee too. So it's a good question. Maybe I can add a few things, and then Amanda, please chime in too. You know, my sense is it is really important for the sustainability of these programs that we figure out pathways to leverage existing state and federal dollars when they are there. There are going to be, of course, kids who are underinsured, uninsured, that may not have that resource, but there are certainly, it's state dependent, of course, but Medicaid in Maryland covers eye exams every year. It covers eyeglasses. It covers replacement glasses. Setting up the mechanisms to sort of leverage existing insurance coverage is tough. And it is, you know, that's probably an entire 75-minute conversation in and of itself. But I think it's important to do because a lot of these programs have really relied largely on philanthropy to get off the ground. And we're moving into a time with COVID and with schools having to deal with so many other things right now that appropriately so, a lot of their attention and resources may be directed towards other programs as well. Amanda and I have actually been looking at sort of the state funding priorities in the American Rescue Plans and noticed that one of the things that was noticeably absent was sort of talking about any funding being directed towards school-based health services in general. There were a lot of things that were being talked about, but these just didn't happen to meet the threshold. And that's not to, there's certainly a lot of other things schools need to be spending their money on right now. But for programs like this to exist in what I would think is perpetuity, as we recognize this, even more so from our research and that of others, the interrelatedness of health and education, we've got to do a better job at figuring out how to leverage billing resources that exist, but to Dr. Stephanie's question, how do we get some of these other pieces covered as well? And will it continue to be philanthropy? Are there other things that we can think about from a state or national level? I think it's going to be an ongoing conversation. Amanda, do you want to share any additional thoughts on that?
No, I was actually working to answer the other two questions we saw that we weren't going to have a chance to.
Thank you.
Sorry.
Yeah, I was glad because there were some questions about iReady that were that are totally in your ballpark.
Yeah.
I would say just one of the take-home things for me from this entire program, and I talked about this with some colleagues the other day. I'm a pediatric eye doctor. I did medical school and residency in Chicago. I've been in Baltimore for 7 years now. And really, until I started working on this program, I'd actually never had a conversation with a teacher or a school nurse about children's vision and eye health. And I don't know, Amanda, before you started working on this program, had you had a conversation with a pediatric eye care provider?
No. No, other than as a child when I got in first grade. But
I think one of the things for us that has been so valuable is the interdisciplinary collaboration and working across sectors. We all get that there's a problem here, and we all get that there are shortcomings to the system, but it's really sort of one of the innovative things about this is coming together across disciplines to leverage our respective expertise to try to solve what is honestly a pretty simple problem. Kids can't see the board. If you give them glasses, they can see better, and it impacts their learning. Like ... That's pretty simple. But what we've realized is the complexity is all the pieces around it, and to solve it, it's so important to have these cross-sector collaborations and discussions.
Thank you so much. And I want to thank. We're just almost out of time. I really believe in letting people go on time. So I'm just going to chime back in and thank Drs. Collins and Neitzel for this fabulous presentation and thoroughly answering the questions, and Lynn for moderating and for asking all these great questions. I, of course, have my whole other list of questions, but I know how to reach you. So I want to thank everyone. I've put in a couple times in the chat the link to the evaluation. I will be sending out a follow-up email with the link to the recording, and then also with some of the resources that they mentioned. And I think that Dr. Neitzel had put in a link to another one of their articles. So we'll be following up with some information, but I think there's so many takeaways today. I think this is such a great model of community collaboration, working together, intersectionality. And I think it's a program that is creating educational equity, vision health equity for all. And I think I am, one of the things that really strikes me that I have a lot of more questions about is that the greater academic achievements or advancements for kids who are special ed kids and for kids who were struggling academically. And I think that's something we should all take away with, how important a program like this is in getting exams and getting glasses on kids' faces. And as most of you know, this is all about what the National Center is. And I'm thrilled to see so many of our partners here and our affiliates and members of our advisory committee and all of you out there in the field, school nurses, Head Start, school administrators. So I want to thank everybody for being here, and we are just thrilled.